Hi friends, I'm Dr. Shweta Goswami. I'm the Medical Director of Zeeva Fertility. We're based out of Noida and Delhi NCR. The topic I want to discuss today is about PGT-A or PGS, which is called the chromosomal screening of embryos. Now, basically, it's a specialized part of the IVF treatment. IVF, if we discuss in brief, is about bypassing small steps in the body which may not be leading to a pregnancy. And then the most important thing in IVF is that suppose we get 10-15 eggs, then we culture these embryos for the next 3 to 5 days in the lab, preferably up till the blastocyst stage. When by culturing them, nature will tell us that out of 14-15 eggs also that we might have retrieved from a woman, there are only 4 or 5 which look healthy, and the others very apparently on morphological grading looks unhealthy, and they are discarded. And therefore in IVF we say, okay, now we've shortlisted or we've come down to the 4-5 embryos which hopefully are normal, which will implant and give us a healthy pregnancy. However, that journey is not really complete. As we know, even if we transfer 2 embryos in an IVF cycle, the success rate at best is 70-75%. When we discuss then in that case, why hasn't it clicked? The usual reason that is given with all the research and the scientific studies that have come up is that these embryos, they look fantastic under the microscope in the lab, but they're still genetically or chromosomally abnormal. Now, a further refinement of this embryo selection or further refinement of embryo quality is what is known as the pre-implantation genetic testing of the embryos, wherein we say that we further do the testing, we do an embryo biopsy, and then find out from the genetic lab that are these embryos which are looking very healthy, because in the lab we're just looking under the microscope, we have a morphological grading which tells us if it is healthy. But this PGT-A testing would further refine and tell us that, okay, out of these 4-5 embryos which were looking very healthy, it is these 1 or 2 embryos that are chromosomally normal, and therefore these are the ones that would give us a result. So that used to earlier be known as PGS or pre-implantation genetic screening. The new scientific term, which is actually synonymous with PGS, is PGT-A, where we say we are trying to test these embryos for aneuploidy. So the question is, does everybody need that? And therefore, we need to understand that there are 4 or 5 category of patients where it makes perfect sense. Now, number one, the tendency of embryos to be what we call aneuploid or chromosomally abnormal increases with a woman's age. And therefore, any woman who is above 36 years of age and makes a good number of embryos, PGT-A can certainly be considered. Second, any patient who, or any woman or any couple who's had a previous failed implantation, which means they've done an IVF before, but it unfortunately did not work out. And on assessment of the records, we find that otherwise everything overall seemed okay. So then what is the problem? Again, we say that no, we need to really know if these embryos are chromosomally normal or not. So anybody who's had at least 2 or more implantation failures would be a candidate for PGT-A. Third, any woman who's unfortunately undergone unexplained recurrent miscarriages would also benefit from PGT-A, because we would be able to further refine that, okay, are these embryos healthy or not? Because again, as per scientific evidence, 80-90% of recurrent miscarriages are also attributed to a random, unfortunate chromosomal abnormality in the embryo, and therefore with IVF we want to refine that further. Fourth, if there's been a history, either in the family or a patient's own history of a chromosomal abnormal fetus, sometimes even during pregnancy we get to know that the fetus was abnormal with a chromosomal abnormality like a trisomy 21 or a Down syndrome. In such women, of course, it is certainly indicated that we should genetically test the embryos before we put them back in. Now, the drawbacks or the problems of PGT-A are, number one, of course, the cost. That over and above the IVF costs that are incurred in a cycle, this is an additional 1 to 2 lakhs per cycle, because based on the number of embryos, it comes to an average of about 20,000 rupees per embryo, and therefore it's a costly treatment, and therefore it's not done for everybody. Second, it's still not a perfect science, and therefore it is always said that we need to further refine this technology further before we use it universally for everybody. And third, very importantly, suppose even if you're thinking that we would do a PGT-A for a patient, but at the end of the cycle, we realize we've got 2-3 embryos only, which are good quality, then you could refine them further if there is a strong medical indication. Otherwise, a lot of times you tend to think, why should we do an invasive procedure? Why should we biopsy an embryo? Why should we incur extra cost? In any case, we want to transfer 2 embryos, so let's just go ahead and transfer them. Unfortunately, if it doesn't result in a pregnancy, the understanding would still be the same, that they might have been chromosomally abnormal. So PGS, PGT-A is now further being used now in an IVF, but we've not reached a point where we would say that everybody needs to do it. There is a subset of patients which would definitely benefit. It's a huge scientific advancement where even before an embryo has converted into a clinical pregnancy, we can actually check if it's chromosomally normal or not. So I hope it helps you in your decision making as to whether you should be considering these chromosomal screening of embryos in IVF or not. Thank you very much.